Chief Executive John Lee's policy address proposes to improve the city's medical services, including fee adjustments. Speaking with TVB News, Secretary for Health Chung-mau said there won't just be price hikes to prevent abuse, but also more subsidies for patients with severe illnesses. Private medical services will also be mandated to step up transparency in pricing. Jackie Lin spoke with the health chief.
The government's policy blueprint has spotlighted the need to reform Hong Kong's medical system. Speaking with TVB News, Secretary for Health Professor Chung-mau said these shakeups could be on the way.
So we know that the medical expenses in public hospitals are now currently heavily subsidized by the government at 97% of the cost. What is the direction now that the government wants to, adjust the medical fees?
In the fees review, which it should actually be a regular exercise. It should be done every 2 years. Services which are likely to be subjected to misuse or abuse, especially those minor illnesses, we may consider upward adjustment. But on the other hand, self-finance item, the cancer drugs are really expensive. Some patients may have to pay way over $30,000, $40,000 a month for these expensive medication. So we'll be considering how to make a more targeted subsidy for these patients.
Some acute conditions like cancer you mentioned are pretty clear-cut. But what about some other ailments that might not be as clearly defined as acute conditions? Would there be an appeal mechanisms for these people or patients?
We'll be enhancing this mechanism to make sure that these people who are underprivileged with financial difficulties, especially when they come to a serious illness with a very expensive hospital bill, we will be able to provide them with more subsidy.
The government also sets sights on ratcheting up transparency in private healthcare service pricing to remedy what he calls public-private polarization of medical fees.
What we are seeing is that in the public sector is super cheap, the waiting time is unduly long, whereas in the private sector, the price sometimes is really difficult to guess, and a lot of people would dare not use the private service, even if they have certain healthcare insurance, like the voluntary insurance scheme. So what we are trying to do is, of course, is to try to make sure that these two tracks are on a parallel track, and to make sure that our citizens can have access to both.
The voluntary scheme for private hospitals to provide pricing estimation started in 2016. Low said the next step is to make the practice mandatory for better fee transparency. They also aim to roll out community pharmacies across all 18 districts in Hong Kong by 2026. Now the government will work out the drug formulary with strategic procurements of medicine, including those that treat chronic illnesses, with digital system upgrades in dispensing medicine and more collaboration with elderly care homes. Jackie Lin, TVB News.